This podcast is for informational purposes only and should not be considered legal, medical, or mental health advice. We speak from our personal experiences and opinions. The views expressed are solely those of the individual speaker and are not intended to malign any group, club, organization, or business.
Welcome to Confronting the Line, where we examine the world of personal development, transformation, and self-help, and explore the sometimes blurry line between transformation and exploitation. My name is Mark Tafoya, and I'm here with Ann L. Peterson, author of the book, Is This a Cult? Hi, Ann.
Hi, Mark.
And we're also back with Dr. Glenn Patrick Doyle, at Dr. Doyle Says on social media, if you want to follow him. We had a really amazing discussion earlier about basically Dr. Doyle's history and how he got involved in this as a teen who was really seeking to find something to deal with those issues that teens have. He found himself reading all kinds of self-help books and really delving deep into the history and the background of so much self-help. And then he went and got himself a psychological degree, and now he's a doctor. He deals with people who are experiencing complex PTSD and dissociation. And in this episode, part 2, we're going to really get into that. What is that? How can people be supportive of people with complex PTSD? That sort of thing. So we're so excited to have you back with us and to get deeper into this conversation.
It is my pleasure to be back with you and to get deeper into this conversation.
All right.
I'm curious, Glenn, what, and you may have told us a little bit, but, you know, a lot of people get psychology degrees and people who have suffered or dealt with their own trials and journeys. My daughter actually is diagnosed with complex PTSD. And so I've learned a lot about it myself. That's, you know, part of why I was really excited to get to know and meet you as well, because she had just had that diagnosis when we met. I mean, it just named it really. And but even she's, you know, now looking at, well, gosh, maybe I should become a therapist, because she has a kind of insider knowledge, as it were. So I'm curious, what led you into the path of trauma recovery, you know, really specializing in complex PTSD. Say a little bit about that, and then we'll kind of move into what that is.
Oh, you bet. Well, I mean, it happens so frequently that, as you kind of imply, it's almost a cliche or a truism that you know, we learn about that which we need to address or heal, kind of in our own experience. Yeah. And so now as I got to work in the mental health field. So my initial idea upon going to graduate school, I told you guys in the last episode, my initial idea was like I wanted to write self-help books. And my initial idea as a thesis project was like, I was really annoyed at people who said, man, that self-help stuff is not real psychology. Because if you're familiar with the self-help literature, it draws on a lot of psychology, actually. But it's not, but it doesn't always make the most straightforward connections. It doesn't cite its sources and stuff. So I wanted to do a thesis project that was like, well, you know, here are the connections between the self-help author and this theory and whatnot. And I got lots and lots of pushback from my committee on that. And so I eventually abandoned it. But at that same time, I was really getting to know the world of complex trauma. So my passion has always been actually not even trauma. My passion has always been addiction. Because I'm a recovering addict as well. My first job in the mental health field was working in a rehab on the east side of Kansas City. And that's what's called a mental health tech. That is to say, the lowest man on the totem pole on staff. And what I observed was, you know, there were many people who were struggling with the same things that I was struggling with as somebody, you know, struggling with my own addiction stuff at the time. But man, the life stories of everybody who came through my program were awful. And what I was finding, even as I started to learn about psychology, was that recovery from addiction was really inseparable from recovery from trauma.
Right.
So that really piqued my interest. And of course, you know, we start to come to terms with our own experiences. And at some point, it actually occurred to me, maybe the fact that I was raised by an abusive, narcissistic alcoholic, maybe that had something to do with my own struggles.
Right.
Maybe the fact that I was sexually abused when I was very young, maybe that had something to do with my struggles. And my journey was not dissimilar to a lot of survivors' journeys. You'll find again and again that we have this moment where we're like, I always considered that just something that happened. I never really
Right.
considered that as maybe something that had anything to do with the fact that I am now myself a raging addict. And I sabotage every relationship that I've ever been in, and I can't seem to stay in school for more than 5 minutes at a time, and whatnot. So again, as I started to work in the field, and as I started to learn things formally, in the field, you start to put two and two together. So that led me to seek to work more with folks, not just addicts. I'd already worked with a lot of addicts, but that led me to seek to work more with trauma survivors. And I ended up working in a psychiatric hospital. When I was in graduate school in Washington, D.C., I ended up working at a psychiatric hospital called the Psychiatric Institute of Washington that had a program devoted exclusively to working with adult survivors of abuse and neglect, what we now call complex trauma. And that kind of solidified everything for me. I mean, that was the thing that kind of brought all the strings together. And like, okay, this actually brings together the things that I've always been interested in. Kind of this idea of, when we're working with, if you're working with addiction, you're working with trauma.
Yeah.
And by the way, if you're working with trauma, you're probably working with some form of addiction as well. But it was getting to work in the field and then making that the focus of my master's thesis and my doctoral dissertation that really kind of crystallized for me that, look, this is the thing, but it also gave me the framework to work my own recovery. Because, we talked last time about how self-help was instrumental in saving my life because of those two factors. One, it instills hope, and two, it imparts tools. As it turns out, if you actually name what you're struggling, instead of just like, I want to empower myself, I want to read self-help books and empower myself. If you actually name what you're struggling, trauma, it sharpens your toolbox and it sharpens your lens. It sharpens your perspective enormously. And so now you can just not just say, I'm seeking to empower myself too, I'm working at trauma recovery. Well, that's where you actually start to make great progress. And that's where you actually start to save your life.
You're speaking about an intersection that I think is really, really important and very overlooked, which is the intersection between sort of mental health, therapeutic diagnoses and treatments and so forth, and self-help. And it's really fascinating to me that in almost every self-help group that, or personal development, that's the more modern word, but it's self-help, is a lot of them poo-poo the traditional psychological stuff. Like, we are better than that. We are more than that. We are the faster, smarter, more progressive approach to healing and to recovery and blah, blah, blah. I mean, I've heard this. I've seen people say it from the front of a room in that world.
Yeah. Do you want to take 20 years and pay for your doctor's pool, or do you want to do it in a weekend? Right. That's the famous thing they'll say, right?
So, but what's interesting is the collaboration of the two, when done well, responsibly and ethically, but when done well, really are totally incredible. I mean, I've always, been in and out of different therapeutic things, whatnot. Coincidentally, the longest time I was out of any other thing is the years that I spent in Landmark, because one, you're not supposed to do other stuff, but two, you just don't have time, right? And you don't have, there's a functional thing there too, but I just find that so fascinating when one side or the other is so dismissive, rather than like, hey, we're all up to something here. We're all up to people, recovering from their traumas, recovering from, their pain of their childhood, whatever it is. And we all have different lenses, different approaches. And when you bring them all together, you just get more power. So I've come to see less the people who experience direct physical, mental, emotional abuse as staff members and so forth. So those that's the worst effects of a high control group like Landmark Worldwide, which I was a part of, for sure, hands down. So that always needs to be acknowledged in my view. But the next impact that is the most dangerous isn't what we got at Landmark. It's what we didn't get while we were at Landmark, because Landmark wasn't collaborative in the way the leaders taught. It's what didn't happen. And now, as I'm talking with so many graduates that are coming forward after my book and saying like, oh my God, that was my experience too. And now as we're all sort of past our shock and awe about, all the stuff Landmark lied about. But now, I have some discussion groups. I'm doing a recovery group with Dr. Rachel Bernstein. But what people are really grappling with is the stuff that didn't get addressed because they were doing that instead. And trauma is one of the biggest things coming up. But I thought I dealt with that trauma. But here it is, and my family is still torn apart, and I'm still triggered by this and that. So, anyway, I just think you've mentioned that a couple of times, that intersection, and I think that's a really overlooked place and red flag. Yeah, Mark, did you have something you wanted to add?
And I think it would be really useful at this point, Dr. Glenn, for us just to define those terms, because we hear about trauma, we hear about PTSD, right? It's in the common parlance now, but I think a lot of people think about PTSD as, oh, that's soldiers who went to Iraq, right? Or someone who had like some massive like things involving weapons and death and destruction. That's PTSD, but I think it's a lot more than that. So can we
maybe
kind
a
of define
crash.
those terms a bit? Yeah, maybe. Yeah. But like, can you help us define those terms? Especially, I'm interested in dissociation too, and what that is. It's like, what is it? What does that even mean?
Sure. Well, and even before we go there, I can tell you, Anne, that what you're describing in terms of the dichotomy or the contrast between, like, do you want to spend 20 years in therapy or do you want to do it in a weekend? I wish that were just a thing between self-help and traditional mental health work, but it's not. Like, that happens all the time in the mental health field. That happens all the time with, like, well, do you want to spend 20 years doing psychoanalysis or do you want to do 12 sessions of cognitive behavioral therapy? That absolutely.
Oh, God.
Like, that's marketing BS, right?
Yeah.
And we're always going to have some version of that. We're always going to have some version of the other guy's thing takes too long and is too expensive. It doesn't really work anyway.
Yeah.
That's great. Classifying that as a marketing thing. Like, that's a marketing thing. That's not a health and wellness thing. That's not a development thing. That's a marketing thing. And being able to spot marketing things for what they are, it's a pretty powerful tool.
Oh, you bet. I know psychoanalysts on the website previously known as twitter.com who will famously say, like, okay, well, the cognitive therapy people say that they can do this in 12 sessions, but ours is actually better. And here's why. When, again, it like that, everybody does it. They even throw it at me, and this gets in the trauma thing. They even throw it at me like, well, you guys, you trauma-informed guys, you trauma guys, well, that's just marketing too. Like, that's just your marketing and whatnot. And I'm like, I don't know who's getting rich off of trauma-informed therapy. Like I know guys who are getting rich out of keeping people in psychoanalysis at $400 an hour for 20 years.
Teal Swan is getting rich off of that.
Teal Swan is not a trauma-informed therapist, Anne, but we can get into what she is.
But that is
besides my perennial crush.
Yes, but it's great, Mark, that the terms, because as the terms have become known and thrown around, they do become marketing fodder, and we only have the most top understanding of what they are. So so what's complex PTSD versus PTSD? Yeah.
Sure. So no one's getting rich. No one's getting rich off of the term trauma. I promise you, no one's getting rich off of the term trauma. Even the guys who are selling lots of books, even Gabor Mate is not getting rich off of the term trauma, because there's no money to be made there. And I'll tell you why. Because realistic recovery from trauma, isn't the kind of thing that can make somebody rich. Believe me, I've tried. No, I haven't. If only. So trauma, broadly speaking, is, Mark, you brought up the example of, we traditionally think of it as something that happened. You go to war, you get traumatized, you come back and you struggle to deal with it, or ends that car, right? Like, man, this thing happens. And sure, that was, for a long time, that's how the mental health community certainly thought of it. I mean, that's where the diagnosis of post-traumatic stress disorder comes from. I mean, right now, like the diagnosis of PTSD in the DSM-5, there is actually in the DSM-5, there is no such thing as complex trauma. Actually, it's not a diagnosis.
I heard that recently. Yeah.
No, that's true. It's what we call complex PTSD, like the signs and symptoms. You'll find some of it and the associated features of PTSD in the text. Like you'll find some of it, and some of it is kind of like reconceptualized as like a personality disorder, and it's a mess. It's a mess. Trauma, broadly speaking.
Oh, go ahead.
Go ahead.
Well, just a quick quip. I heard recently I have several trauma experts in my circle these days that the guy who wrote Body Keeps the Score, I always say his name wrong, said recently at a conference that if you took the trauma out of, trauma induced events out of the DSM, it would not be a 3-inch thing. It would be a pamphlet.
Yeah.
And I thought that was so, I mean, just having come so up close and personal with the repercussions of trauma in my daughter and honestly in my mom, and I'm starting to discover a little bit in myself. I was like, oh yeah, I could get that. So anyway, go on.
You bet. Trauma, broadly speaking, you can get lots of definitions of it. I personally like the definition of a thing that overwhelms our ability to function. I think that's a pretty fair, broad strokes definition of trauma. Right then, I'm going to get people who are mad at that because they're going to people say, well, man, something can overwhelm your ability to function. I wouldn't find that a trauma. Like if you, I don't care if you find that a trauma. If something overwhelms my ability to function, it is traumatic to me.
So it's going to be relative, right? Yeah.
You bet. If it overwhelms your ability to function and leaves a mark, is going to be kind of my broad strokes definition of trauma.
Okay.
Complex trauma is a slightly different animal. Kind of like a lion is a slightly different animal than my cute little house cat sitting right here. They're slightly different animals. They bear some resemblance, but they're kind of different.
They both got teeth and claws.
They both got teeth and claws. They're both nature's perfect killing machines. So complex trauma is trauma. But it's trauma that tends to look often different and have broadly say different, tends to be more effects than traditional, what we think of as simple trauma or traditional trauma. So complex trauma, the markers of complex trauma are it's trauma that occurs over time. So instead of these like flashbulb events like 9/11 or car crashes that happen in an instant, or they just happen in a discrete time period and then they're done. Complex trauma tends to happen over years, over months, over years.
Yeah.
Okay.
Complex trauma is trauma that becomes entwined with almost all of your relationships. So again, like, will a car crash impact your relationships? Sure. But if you're living in, for example, an abusive home environment, or if you're in an abusive religion or spiritual group, and all your relationships are kind of revolving around that, that's one of the hallmarks of complex trauma.
I see.
The other hallmark of complex trauma.
Sorry, so what immediately came to mind is like the thought of, well, daddy's coming home and I hope he's not drunk every day over years is distinct from, you maybe you had one moment or one instance where there was something abusive happening, but it was literally, is daddy going to be mean to me today?
You bet.
Yeah.
Well, or sexual, if there's like sexual abuse over time, that was one, there's two kind of significant abusers or perpetrators in my daughter's story, but one was a sexual abuse over time, and then one was literally a evil stepmother situation, right? So, but they both lasted for years. And then that's interesting what you're saying, and it entwines in your relationships, because while I didn't know about any of, I knew some stuff, but not all the stuff. But one of the things that my daughter and I kind of went through in therapy at one point is, why didn't mom save me? And you can bet that my daughter's trauma is all over our relationship, right? Even though I wasn't the one there.
The other hallmark of complex trauma is that it was functionally inescapable. And that's an important piece, especially when it comes to, so for the example that I use all the time is, if you're involved in a cult, coercive spiritual group, abusive family, we can't just opt out. People ask all the time, well, if you were being hurt, why didn't you leave? Well, the contexts that tend to generate complex trauma were functionally, realistically inescapable. You just can't opt out. You're a kid. You just can't opt out of your family.
Teenager can't just go live on their own. I mean, they're dependent on their
and
family.
Look, and you're always going to get people. I guarantee you're always going to get people say, "Well, I did. Like, I left. Why couldn't you leave?"
But Glenn, this is one of the big things that people are saying, since my book came out and I sort of revealed this kind of abuse in the highest circles at Landmark. But what's been coming out since then is like that abuse was in kind of in a lot of places, verbal, emotional, really, high control kind of abuse. Would that, like somebody who was on staff in that kind of environment or work, because Landmark isn't alone in that kind of toxic work environment, could a person who experienced kind of extreme pressure in those kind of environments suffer from complex PTSD?
Of course, because again, the key term is functionally, realistically inescapable, right? So technically speaking, you could always quit, you could always walk away, blah. But I mean, we talked about this a little bit in the last episode. When your entire social network, a lot of times your entire family, like you see this in Scientology a lot, where their entire family is like part of the church.
Your reputation too. That's another one. Like
your livelihood.
Your livelihood, your reputation, because you've been preaching this thing is the best thing since sliced bread. So, for years and years and years and years and years and years. And, so to leave and, certainly to criticize it is trust me, it's unimaginable until it isn't. Then you write a book.
So you bet. Well, and the fact that it is functionally inescapable leads to kind of the broad characterization of complex trauma, that it's trauma that was ongoing, that was inescapable, that twined in our relationships, and that we had to adapt to. Like necessarily, our nervous system, our endocrine system, kind of our human creature, had to find some way to adapt to what was going on, because we couldn't just walk away. We couldn't just walk away. We couldn't just not have relationships, right? So the way that we coped, the way that we continued functioning such as it was, is like we formed our nervous system kind of around this ongoing trauma. Then, like, even if we get out of that traumatic environment, we leave the family, we leave the church, we leave the cult, et cetera, we are still left with all of these coping mechanisms that, by the way, were not one-time choices. It wasn't just one time I experienced this stressor and I decided to cope this way. It happened again and again and again, to the point where it is now a reflex that we call a trauma response. Yeah, right?
Like, how do you date? How do you form good relationships with people when you experience 20 years of abuse? Yeah, it's difficult.
Big time.
Well, you also internalize the structures. You internalize the rationalization system. So, I've now talked to a number of people who stayed in abusive relationships because, well, they could just invent a new context. They could create a more empowering context, or they could whatnot. And so maybe they got out of that relationship and they got away. They're now no longer, participating full-time or working full-time for a high control group like Landmark, but then they're still doing those patterns, right? They're still taking way more responsibility than is functionally even viable. They're still trying to recontextualize through language, disregarding the physical universe. They're still, that because you internalize those tools, and those tools are what binds you in a high control group. Like it's what you use to rationalize the trauma. Yeah.
So, Mark, you asked about dissociation a second ago, and that goes to it's a psychological defense that we don't choose, that we develop, that we reflexively develop. But it goes to what we were just talking about complex trauma context being functionally inescapable. When a situation is painful and yet functionally inescapable, something's got to give, right? Like we've got to figure out a way to be here but not be here.
Yeah.
And so that's what dissociation actually is. It is an internal splintering, and it exists on a continuum. You can be a little dissociative, like the example of being a little dissociative is when like when you're driving on the highway and you kind of space out, and then voila, you're at your destination, right? You got a little dissociative to deal with the boredom of the thing.
How did I make it here without getting hurt?
You bet. And that's it. But that's an example of the type of process. It's not strictly dissociation because it's not trauma driven necessarily, but it's that kind of thing that it's a sensation of being here but not here. A part of me is here, a part of me is here and functioning and whatnot. Whereas the other part of me is emotionally and intellectually and cognitively kind of removing myself, even sometimes physically removing myself. This is where we get this felt disconnect between our body and our consciousness, right? So, for example, we're being physically abused or sexually abused, and there's no way to not be there. There's no way to escape. Well, our nervous system finds a way to not be there, right? Like it kind of cuts us off from these physical sensations, and I'm floating up there and on the ceiling.
Is that where people kind of invent their own little world to be in, to kind of so that their focus can be on something other than what's physically happening?
You bet. And at the extreme of this spectrum is what we call dissociative identity disorder. I don't like calling it a disorder because I think it's an extraordinary adaptation, actually. I think by calling it a disorder, we're like, survival. No, you shouldn't be doing that. But it is absolutely a survival adaptation. But what used to be called multiple personalities, right? Because the splintering gets so bad that it seems as if the parts of us that are holding either various memories or various feelings or various experiences that we cannot hold in consciousness and continue to function seem to develop lives of their own, like personalities of their own.
You get this like Sybil, right? That was the famous movie back in the day, right? Sybil, who had 17 different personalities or something.
There's a really good series on Apple right now that goes into this. For the life of me, of course, now can't think of the name of it, but it's really, really, really good. It's actually about the first psychologists that sort of not diagnosed exactly, but gave name to that. And it's in that story and who her patient was and whatnot. It's really, really, really amazing. Google around, you'll find it.
You know, the Sybil case is complicated and that gets brought up a lot. I think it's important for folks to understand that dissociative identity disorder, it can look like that. It very often doesn't. Very, very infrequently, actually, with dissociative identity disorder. I've worked with dozens and dozens of folks who have dissociative identity disorder. It's very infrequently kind of this very public, dramatic, like you almost never catch someone switching.
Yeah.
What usually happens is, folks like switching tends to be between parts. We call them parts or alters. Switching between parts tends to be very subtle. It tends to be very covert. In my experience, folks who struggle with DID, the very last thing they want is for somebody to see them switching, right? Like, I mean,
right. Yeah. That's part of the mechanism, right? Like I can't let you see this because I need to protect myself here, right?
You bet. So I always tell people that because I get people asking like, well, how can I have DID? I'm not Sybil. I'm not switching all over the place and whatnot. I'm like, that's so.
How is that different
United
than
States of Terror, right? That's another show that depicted that, right? And in a very dramatic way, which probably is accurate.
How is that different, or is it a spectrum or scale? But like I felt like, was particularly in the time that I was deeply, deeply involved in Landmark, I had kind of some different personality. Who I was when I walked into a Landmark center was very different than who I was when I walked into particularly my husband's family, which was a very staid Christian family. Very, we have different political views, different, I was like an alien creature in that family. And in a lot of ways. And so I just adopted, I adjusted myself to be appropriate to that environment. And we all do that to a degree. If we're situationally aware. But there are literally times where I did feel like I had my Landmark leader personality and then, others. And then eventually part of the problem was I couldn't not be the Landmark leader personality because everybody I knew related to me as that. So even if I just wanted to be, Anne, I couldn't really be that because people saw me as a leader. And that was a whole thing inside of leadership training, actually. Like, Mark, that's part of why they were telling you that you had to adjust your lifestyle, was because you got to be responsible for this identity. That's a whole thing in these groups. I don't know if we've talked about it directly. If you've been listening to me, you hear us talk about the whole process of designation, where you actually become the thing itself. It's like,
and you declare yourself as that.
Who I am is. It's not that this thing that I do. It's who I am is. And, the more I deconstruct the whole high control, LGAT, cultic world, the more I see that there is this kind of whole replacement of your personality. Like, you become that thing. And that's how you win in those worlds. That's what has high control. High control for what? Be that. Because you're our representative in the world, and you need to sell stuff.
Oh, you bet.
Interesting.
And there's, and check it out, like in high control environments, from religion to the military, there's a long tradition. The military does it explicitly, right? Like in basic training, we break you down to build up this person. Right? Like we break you down so we can build you back up into the soldier that we need you to be.
That's one of the core things in the human potential movement, as it was manifest by the Werners and the L. Ron Hubbards and the Tony Robbins. And you're seeing it even now in some of the young guys as they kind of revert back to that, because it's a power game and they're always on top. So they are breaking you down in order to have you something. That's a piece I'd love to see erased out of the whole lexicon.
It's a really seductive trope. It's existed in our culture for a long time. Saul becomes Paul after getting struck blind on the road to Damascus, right?
By lightning, right?
Right? And it's a trope that's been around for a long time. And there's a reason for that. It's because we love that idea. We love the idea of the flash of insight that turns us into a new person. Because check it out. If I'm and I think this is a trauma thing. Of course, I think it's a trauma thing. I think everything is a trauma thing. But I think one of the reasons why it's seductive is because if I get struck by lightning and I'm suddenly a new person, then I don't have to deal with anything that happened in my past. That didn't happen to me. That happened to him.
Right.
Okay.
Right.
I can just start from scratch. And I know how seductive it is. I remember being in 7th grade. So this is me desperately depressed as a kid, as a very young man, and I remember making lists of everything that comprises a human: personality, eyes, hair, skin color, height, weight, blah blah blah. And I remember thinking to myself, I could change each one of these incrementally. I could change each one of them, and then by the end, I would have a whole new person.
Yeah.
And that was one of the first ideas in this ecosphere to really turn me on, that, oh man, I could be a completely different person. Then that kid who got heavily bullied wouldn't even exist anymore. That kid who got sexually abused wouldn't even exist anymore. That kid who, you're
talking the whole lure of transformation, right? I can be the butterfly. When I'm the butterfly, I am not the caterpillar anymore. It is gone. It was dissolved in the cocoon. And so now I can just live the life of a butterfly. And that is, I loved you said that in our previous episode, but it's worth saying again, that is kind of the fantasy that we have to give up. I just came into this. I've been realizing this myself inside of my whole teen mother story. So I used to always say what I got out of my participation in Landmark, and it's not entirely untrue, was that I wasn't locked into, here's their language, who I wound up being, because I got pregnant and had a child at the age of 15 and wasn't able to go to school past the 9th grade. I mean, I was on my own from 16 supporting myself. And so that meant that dictated a certain life. And when I did the forum, I got, oh, that's a story. And actually it was the advanced course, but it's a story and I don't have to be that anymore. And I really,
And you're not stuck with
kind
that.
of live.
Yeah.
I'm not stuck with that, right? So, except here I am, 55, going on 56. Next week's my birthday. I want cards from everybody. But and dealing with like, okay, I got dropped off the Landmark spaceship, and I looked at going back to school. I would be 61, 62 to get like the most base degrees, right? And I started to realize like it all started. Guess what it started with? I'm a teen mom. I'm a 56-year-old teen mom. Like that circumstance did not change. And I know Landmark people don't have to put this in the comments either. It's not the circumstances that changes. It's my relationship to the circumstances. I got it. But the circumstances are still doing a lot with my life. And I did live a long time making decisions as if that weren't the case. Because if I'd really held on to like, oh gosh, I'm still going to deal. What's my retirement going to be? What's my, really dealing with? I might have left Landmark a long time ago and gone back to school when it was still a really viable thing, for example, and gotten a therapy degree or something that was actually marketable in the marketplace of economy that we live in, because being an ex-Landmark leader is not marketable at all. So it's like this interesting thing. Like we want to say, okay, we can change our relationship to that, but it still doesn't change that. You got to hold both, you know? So coming back a little bit to complex PTSD. So how would, I know I can just hear people listening kind of going, well, do I have that? Like I had a lot of stuff going on in my childhood, and how would one know? And does that even matter? But how would one know maybe that they were dealing with, even PTSD or complex PTSD? I'm not sure if it matters either way, but how would you know that maybe some kind of trauma work or recovery, like actual scientifically, anyway, we'll talk about what kind of things you can do with that. But how would I know either myself or someone that I love might be suffering from complex PTSD?
Sure. So, I mean, how would you know that somebody you love is suffering from complex PTSD or anything? It is a trickier question because we can never quite be on the inside of somebody else's experience.
Right.
But it's my experience that folks who might be struggling with complex trauma, like it's rarely a question of gosh, my life is awesome until I realized I had been abused and now it's terrible. Usually the way this presents as man, my relationships, like I said about myself, my relationships are a mess. I am addicted to 4 different things. I can't stay in school for more than 5 minutes. I'm having nightmares. I'm having flashbacks, etc. You don't think that could have to do with that, do you? Like, because we almost all start out from a place of denial about it. Yeah. That's not our fault. Like that's where we're wired.
Right.
Almost always, when somebody, well, by the time they get to me, they usually have had somebody suggest to them, like, this might have something to do with what happened to you way back when. But check it out. Even if somebody shows up at my office saying, well, I'm a trauma survivor and I need help. Like, we don't immediately start out, all right, what happened to you? Right? Like the process of recovery is a day-by-day thing that exists in the now. And we deal with the past as it intrudes on the now. And that's kind of a hallmark thing of most trauma disorders, whether we're talking traditional PTSD or complex trauma. There's usually some version of the past intruding upon the present. Sometimes it's from flashbacks. either these sensory flashbacks where you literally feel like you're sucked back into the past and you're seeing and hearing and smelling things that did once upon a time. Sometimes it's what we call emotional flashbacks, where it's not the full-on sensory experience, but suddenly emotionally you're feeling like 10 years old again, and you're feeling disempowered and small and vulnerable, et cetera, et cetera. A lot of times it's nightmares. I can't, guys, I can't count the number of times when I've had someone say to me, you know, gosh, you mean everybody doesn't have awful dreams and wake up in a panic every night? You mean that's not a universal human experience?
Well, check this. One of the things that a number of people have shared with me, you know, there's a group in which a whole bunch of people who have been in high control groups, mostly Landmark, but some other ones as well, post my book are like, whoa, like it was, you know, they read my book and they're kind of like, yeah, that happened to me too. Like they had all those things they were hiding about the organization, about their experience, they got to. And one of the big things that's come up for a number, mostly ex-staff members, is they're having nightmares. That's one of the things that coming up in the group, like, oh my God. And, you know, and I've wrestled with like feeling a little bad. I'm like, oh God, maybe I shouldn't, you know, that was always my biggest fear about talking about the dark side of Landmark, was that people would invalidate their transformation. It never occurred to me that people had trauma from that experience, and that my book might awaken that in some way.
Yeah.
And
trigger it for people.
Is that a trauma response? I'm like, oh man. I mean, I hope some of those folks are listening so that they have a way to relate to that, because that's been kind of one of the experiences people have been talking about. Like, oh my gosh, I haven't thought about this in years, but now I'm having nightmares.
You bet. You know, and I've never been nuts about the way that trauma is talked about in the culture, because I feel there's this temptation to reduce it down to you either have it or you don't. And I've never been nuts about that, because I feel that opens the door for somebody to say, well, what I experienced wasn't what they said was trauma, and my experience wasn't exactly what they said was really trauma. One of the things
you
with
mean like people
trauma,
might diminish it?
well, that people might diminish it, but that people might diminish their own experience because it doesn't meet some definition, or it doesn't look like what other people are describing as trauma.
Right.
And so I've never been like I've never actually been terribly interested in this entire conversation of, like, I get constantly, I get people asking, well, is this trauma? What is it? Is this trauma? Which is why I go back to my broad strokes definition of, you know, look, if it overwhelmed your ability to function and if it left a mark, well, sure, we can call it trauma, but that's not interesting. Let's talk about recovery. Let's talk about whatever you need to do. Like, so for example, I have had patients come to me and say, man, I always assumed I was a trauma survivor because I did have something happen, or I think I had something happen, or I was told that something happened to me. But man, like, my experience doesn't exactly match this and this and this. And sometimes you can't even necessarily make a diagnosis of PTSD. Does that mean they're not a trauma survivor? Well, no, I've never been really interested in that conversation, because I'm a recovery guy. Like, I'm way more interested in, like, okay, whatever the hell you happened, call it whatever, man.
Yeah.
Call it.
How are you going to move forward and be healthy? Yeah.
You bet.
I mean, the main value to naming it is getting insurance to pay for it, honestly. If you have insurance, it'll pay. Like, that's what I told my daughter, because she hated being labeled as whatever. And I said, but when you have an actual diagnosis, you can access resources. Like, to me, that's been the and you have something you can look in a direction maybe. But I love what you're saying about recovery. And, you know, and I've really adopted that language, as we call even our LGAT, or high control recovery group, because that's where we want to put our attention. You know, just like seeking safely, we want to put our attention on the safe and ethical practice of personal development and wellness. We also want to put our attention on recovery. But there's a thing about, a lot of people want to skip the bad news, and that you can't get there through that either, right?
You bet. No, you bet. And if we want to get into the conversation about the pros and the cons of slapping labels on things.
No, that's a whole other episode.
It is, but I'll just briefly say that a very common experience for a lot of trauma survivors, especially if they've had extensive experience with the mental health system. It's a very common experience to be misdiagnosed, what I would call misdiagnosed. So it's pretty common by the time someone makes their way to me, it's pretty common to at some point have been diagnosed with borderline personality disorder. Right? It tends to be pretty common. I would say, like, I don't have hard numbers on these.
I was told that that's basically untreated trauma. It's unrecovered trauma, like trauma that's had no integration, no attention, no recovery effort is pretty, because my mom was diagnosed. I don't know if she was diagnosed, but we diagnosed her a long time with borderline personality disorder because she fit all the things on Google and WebMD and all that, right? But what I came to see as I started to learn about trauma, I was like, oh, that's because all that, when she was raped and imprisoned and we escaped and and then she went into that other abusive relationship and then she went, and then there was that third one. And, and she did eventually end up with a really good guy, but she never, that I was aware of, really dealt with in any kind of effective way. And I'm not sure how many effective ways were available in her time. She died in 2020, one day before her 70th birthday. So, she was trying to survive all that in a time when literally trauma was only related to those who had gone to war, and definitely not even the women, only the men who were in combat. So she didn't have any access to recovery, really.
Sure. And check it out. Like, there are all kinds of conversations to be had around, just take borderline, for example. There are all kinds of conversations to be had around, is borderline personality disorder the same thing as complex post-traumatic stress disorder, or are they different things that just have a huge overlap, or like what's going on there? And those conversations are had by people far smarter than I am and who are interested in different things than I'm interested in. It is my observation that the main utility of diagnosis, with rare exceptions, like diagnosis can really make a difference, for example, in certain things where medication is going to be the difference maker, right? So bipolar disorder is going to be medicated differently than schizophrenia. Okay.
Yeah.
So that
panic disorder or something like that. Yeah.
But when you have things that are not that clear cut, and where medication is not going to be the difference that makes the difference, it's my experience that diagnoses frequently serve as the point where funding sources, notably insurance, can stop funding somebody's recovery, because you say, okay, you got better enough that you no longer meet these criteria. So we don't have to pay for this anymore because it's no longer a disorder, right? You're on your own. Which is why I've never been a fan of
then we're to the whole healthcare versus sick care, right? Which is
there's
a big
guy on
problem
Twitter. There's a psychoanalyst on Twitter who constantly tries to draw me into this conversation about borderline and CPTSD and whatnot. And I'm just not interested, because I'm not, look, if disorder is on the end of it, you're outside of my interest. I'm interested in post-traumatic
you want people to feel better.
recovery.
Yeah.
You bet. Yeah. You bet. I really wish that diagnostics was more, and this is a soapbox I can be on all night, but I really wish diagnostics were more about the functional impairment as opposed to the presumed cause of the functional impairment, right? So instead of saying you have...
That would be life-changing, because we haven't gotten any real insurance support for in 10 years. I mean, my husband and I have spent tens of thousands and thousands of dollars on all kinds of supportive treatments and whatnot, and none of it's been covered by insurance. Like none of it, actually.
It's also the case in the assessment of trauma survivors. Almost never upon initial assessment are you going to get a good assessment, and that's nobody's fault. That's a result of the fact that very often survivors, one, are not all that keen on or skilled at describing what's going on with them, right? Especially if dissociation is part of the picture. It's also the case that you are one mental health professional, probably among dozens that they might have had contact with, probably not great contact, at least half of, right?
Yes.
So you're not going to get a great assessment, and probably not a great diagnosis in the first place. So I've never been real keen on these conversations about like, well, let's get at the finer points of the diagnosis. Is this PTSD or whatnot? All I know is what I know. Functional impairment is what people come to me. People don't come to me for, to get another label. Yeah. So look, sometimes people will say, man, when I got that diagnosis, it added clarity and finally, like there was like there was words.
It helped me understand.
I had that with my autoimmune disorder. When the doctor named my autoimmune disorder, I mean, I literally wept because I had an explanation. But I have the doctor I'm working with now is like, okay, you need to stop saying you have that. And I did try stop saying I had that for a while, but then I ate way too much gluten and had problems, so I had to go back because having that meant don't eat gluten. Anyway.
Or like me, when I had my incident with Larium, and I started to bug out, in halfway around the world, and it was so crazy to me. And then the moment I Googled and said, oh, wait a minute, this has this side effect, it at least started to make sense because I'm like, oh, okay, that drug did that to me because I'm not normally like this. This hasn't been my experience of myself, right? And it was contraindicated for people with neuropsychiatric disorders, and I hadn't been that. But it really started. It was a relief. Okay, it's that drug. I'm going to stop taking that drug, and hopefully I can be on the road to feeling better. And that's just an incident. That's not someone who has complex PTSD. That was just a moment that happened because this drug had this effect on my brain.
So let's kind of talk a smattering about. Did you want to respond to that, Glenn? Sorry.
Sure. Just briefly, like the limitations of labels, I think are really well illustrated by the language that we use to speak about addiction. So, for example, somebody who has abstained from their substance of addiction for 20 years, if I assessed them today, I could not diagnose them with a substance dependency, right? Like there's nothing that I could put on that.
Right.
Yeah.
That said, folks in recovery know we are always in recovery. Folks in like that's one of the reasons why in the kind of the old 12-step model, you never say, oh, I'm recovered. Like you always say, I'm in recovery. I'm working my recovery day by day. I again, like most of the stuff, the best stuff anyway, in my approach to working with trauma, I stole from the addiction recovery paradigm. That's why I say, look, we are not looking for the cure for PTSD. We work our recovery. We're not looking for the thing. Yeah. That's where I have a real problem
day to day.
You bet. That's where I have a real problem with folks who kind of sell this like that's this treatment or this technique or whatever that's going to do away with your trauma. Like, how do I fix it? Say, well, we work our recovery. We wake up every day.
This is another intersection with self-help because there was literally a moment my daughter yelled at me. There's a couple moments where she like yelled to get my attention. They were really good moments. And one of them, one was, Mom, feel your feelings. So the other one was, Mom, stop trying to cure my complex PTSD. And I didn't even really know I was doing that. And when I examined it, it was because I was coming from this human potential mindset of, well, you can cure that. You can create a new context. You can complete the past so as to transform, and as transformed you wouldn't suffer from complex PTSD. I really believe that to my marrow. And I do think, we had a recent interview with my ex-Landmark Forum leader, who's a great guy, has made a huge contribution in his life, whatnot. And, it works with people around trauma. And I've talked with a few ex-Forum leaders that kind of have this idea, but no, you can transform and you won't suffer from that anymore. And it's kind of like, but that's dangerous because then when that person, a year after that program or that coaching engagement or that whatever, I don't care how long it was, they start suffering functionally from that condition or that whatnot, they're even further down because it didn't work on me. That cure didn't work on me. That forum didn't work on me. The curriculum for living didn't work on me. I've seen it. I saw it in the Being a Leader course. We had an amazing guest who came a couple years in a row who had been in a military environment, a very intense one, and had suicidal ideation and was trying to deal with that in a leadership development course. And that's not while he may make a difference in some aspects of what that person was dealing with, it's not going to cure the PTSD. So I kind of have a problem with the whole cured thing. It sounds like we might have the same problem coming from two directions, right? So, but I was firmly embedded in the you can transform it, which is code for cure, if we're on it.
You bet.
It's not.
And I think there's absolutely legitimacy and validity to the desire of survivors who are suffering, and they want to say, man, will this ever get to the point, even if I work my recovery, like, will this ever get to a point where it's a non-issue in my daily life? And I hear that, and the answer to that is, yeah, sure. Provided we accept, and this is why step 1 of the 12 steps is all about acceptance, right? It's both, it's first, both because it's hardest, but it's also most important, right? If we accept that there is no recovered, there is only recovery, well, that actually kicks open the door for us to work our recovery every day and get to the point where not only does it not F with you the way that it used to, but actually these tools and skills that we develop in recovery allow us to access a quality of living that we never would have accessed otherwise. Like I say this all the time, like I don't wish trauma or addiction on anybody. Dude, including myself, like given the choice, I would have chosen something else every single time. That said, if this is the hand we've been dealt, we have this toolbox called recovery that can actually kick open the door to a quality of life that we never would have known had we never been forced to access this toolbox, right? So the answer is, not only will it get to the point where it doesn't F with you, but get to the point, it will get you to recovery, will get you to the point where you're doing things and living a meaningful quality of life that would have been inaccessible to you otherwise.
That's beautiful. I think I don't want to go too much past. I just have one question on the tail of that as we wrap up here. I know this is a big, recovery tools is probably as big a toolbox as getting us into needing the toolbox, traumatic, what can be experienced as traumatic. But is there something, maybe some directions that you could send some of our listeners? And if they think that they are, if they're beginning to recognize that they may be dealing with, some functional impairments in their life that could be connected to traumatic experiences, where would you recommend they start to look to, move towards in a recovery direction?
So first things first, if you've had experiences in your life, either that have been painful, disruptive, that you still carry with you in some way, whether we're talking about nightmares, flashbacks, intrusive thoughts is a big one. It's worth it to at least give a Google to trauma symptoms, right? Like just give it a Google and see if it sounds familiar, right? The other thing that it is pretty common is if you have some of the symptoms and struggles that we've been discussing tonight, but you actually don't have a lot of memories. Like, so there are some people who don't have a lot of memories in the long term or the short term, and yet they somehow are here and functioning and whatnot. Again, I don't want to go so far as that, there are definitely people who are like, well, if you don't have memories, that definitely means trauma happened. That's not necessarily the case. That said, it's worth just giving a quick skim to a series, a symptom list. I also say, gosh, I'm going to get some heat for this from mental health folks, but I also say, look, if you have that diagnosis, if somebody has affixed that diagnosis of borderline personality disorder to you, do some thinking about your past, do some thinking about your experiences, and do some serious thinking about, whether it is more useful to conceptualize, is this a problem with, think about that term, personality disorder. Is this a problem with my disordered personality? I'm just like it. Or does it make more sense, and is it more useful to think of like, maybe these are adaptations to things that happen, whether I remember them, whether I don't remember them, maybe these are things that made perfect sense once upon a time. They're kicking my butt now,
Yeah.
right?
Yeah.
So ask yourself, like, what is a more useful paradigm? Like, what's a more useful model there?
Yeah.
I'm amazed that anybody would prefer to, but I know people who do. That anyone would prefer to think of this as, their personality disorder. They're just like,
Yeah.
I'm amazed that anyone would prefer that model.
Like maybe you adapted to that. There was a way to survive, and now you don't need it anymore. But it's become such a part of you that you think of it as you.
You bet.
I think this is a problem with people when they come off staff. So we just had in the Landmark lexicon, right? They just laid off most of their staff, and a lot of, and I'm now talking to enough ex-staff members to start to see the patterns. And my heart is so with these folks, and this is why I started the group with Rachel, to give a place where we could talk. We could just talk. What's going on here? Because one of the things that happens, that environment is so particular. It has its own language. It has its own stressors. It's just very, very particular. And I've heard the same thing. We have doctors that are actually leaving the medical profession in droves because of, how traumatic basically it is to be in our health profession, particularly coming through the pandemic, right? But then you come out in the world and you can't get it together. You can't, like, what? I can't. And you find yourself, you're using strategies that worked there that don't work here. And when I first went off staff, one of the things that I did sort of instinctually, but in retrospect was really smart, is I actually got somebody for a year to work with me. I said, I need to be a normal person. Like, I recognized I had worked and moved inside of a very particular world, and now I was going to be, it turns out it wasn't as different as I thought, but different world with my innovative event management and hosting the Being a Leader course and hosting for other thought leaders and gurus. I'm like, oh, I need to learn how to, like, literally act and move differently. And even email, I had to learn how to use email. So that's kind of that sort of cultic lens, but whatever it is. So take a Google, take a look. Anything else that you would point people at, or just to kind of start to get them started in considering this and getting support? Here's what I'm actually concerned about is people go do the Landmark Forum to cure their trauma. That doesn't work, guys. Don't do that. Don't do it. I don't care what weekend course it is. There's no weekend course or week long or thing that's going to cure you.
Sure. But that said, people are always going to seek out tools.
Sure.
Right. Like we can tell people don't go to Landmark to cure your trauma, but the truth is, like, why do people go to Landmark or anything? They go for support and tools in the struggles of living. And
that's a great point.
Right. So that's going to happen.
Maybe that's the line. Go for the tools, not for the cure, kind of thing.
You bet. Well, and remember, like, I'm going to bring it back to, my own journey in self-help, that it's divided up. The two big gifts that self-help has the potential to impart is, on the one hand, there's the hope, and on the other hand, there's the tools. And this brings us back to the seek safely philosophy of, look, self-help or personal empowerment is not the enemy. Like, I'm never going to tell somebody, like, you've been traumatized, therefore don't go to Landmark or anything, right? I'm going to tell anybody that, whatever tools you choose, because, by the way, it's a fallacy that if you have experienced trauma, that the only way out of that is therapy. I'm going to get Ginny Brown mad at me because we have conversations about this, but I'm never going to tell you, look, there are some crappy therapists out there. There are lots of non-trauma informed therapists that create more problems than they solve when they try to work with complex trauma. The mental health field has, the thing that for as effed up as the self-help field is. Oh, I've got some bad news for you about the mental health field and the history of the mental health field. Oof. Right.
Quacks.
So any tool that you use, including therapy, whether we're talking self-help products and services, whether we're talking about psychotherapy, what you want to do is, keep your wits about you. Stay grounded. This is where the compass tool comes in handy. Stay grounded in your values, your needs, your goals, and your history, your understanding of your history and your vulnerabilities, right? And make sure that the hope that you're drawing and the tools you're acquiring from any tool, therapy, seminars, whatever it happens to be, make sure that they're realistic. Make sure that you have a a good sense of when and how it could potentially turn toxic.
Yeah.
Because this whole thing is not about not seeking. This whole thing is about seeking safely. To coin a phrase,
Yes, we love
use
that phrage.
You
To
bet.
thine own self be true, as Polonius says in Hamlet, right?
Well, Dr. Doyle says, and I want to say that for folks, I follow Glenn on Instagram. I don't do that other formerly named Twitter platform, but I do the Facebook and the Instagram, and I absolutely love your Instagram feed. You have been therapizing my daughter for years through forwarded Instagram posts. And me, really supporting me and understanding, wow, that's what's happening. She's not just trying to make me insane. Like there's something really going on there. And, it's really led to incredible, incredible healing conversations between my daughter and I, literally just following. So one of the places I'll point people is to Dr. Doyle Says. The other place for those that are using the self-help kind of tools, check out the SeekSafely.org. We'll put it all in the show notes too, but
and the summit, of course. Let's not forget the upcoming Seek Safely Summit.
We're launching this summit. Well, we're launching the Seek Safely Summit. So we'll a 1-day summit where you can come and get some quick lessons. So you can't do it in 3 days, but you can do it in 1 day at the Seek Safely Summit. No, lying. So
Careful.
I just couldn't resist the joke. Come on, it was lying right there.
Disclaimer now. Disclaimer. Scrolling.
Yeah. The Seek Safely Summit will not cure your trauma. The 90-minute session that Dr. Rachel Bernstein and Dr. Glenn Doyle will be. Sorry, Rachel is not a doctor. She's a educator, and therapist. But that 90-minute session will not cure your PTSD. It will not have you recover fully from cultic or high control abuse, but it'll set you on your way, and it will give you some tools and some insight into what you may be dealing with that you haven't fully understood. That's been what's really great for me as I follow you. So thank you so much for spending this time with us. I know there's more to come. I am, I couldn't go to college, so I decided instead I'm going to become a Seek Safely evangelist and supporter, and even dedicating the platform we've been working to launch, Illuminate Life, will be dedicated to the safe and ethical practice of self-development, and a place where practitioners that commit to the Seek Safely promise and really want to learn to function and live that way can advertise and promote their services and collaborate. So we've got a whole world that we're creating in what I like to call the Seek Safely movement. And, Dr. Glenn Patrick Doyle, not to be confused with the other Doyle, is an integral part of that and partner. And thank you so much. Anything you want to say in closing words?
Thank you so much for having me. I'm always surprised and kind of amazed when people actually want to talk to me on these things. But I will throw out there that so the week before the summit, so we're talking about the week of October 6th. So I always say to my social media audience, I never ask you guys for money, except once a year, exactly once a year. I ask you guys to consider an investment. So once a year in October, Seek Safely does our annual fundraiser. We do it the week of the anniversary of the tragedy in Sedona. So it's going to be the week starting October 6th for that entire week. We call it Seek Week. Mm-hmm. And what we do is we do nightly live streams with various members of the Seek Safely organization and board. So it's me, it's Jean Brown, it's Christine Whelan, and we essentially have a week of conversations, questions and answers, and highlights from our podcast, the Seek Safely podcast. Where we really dive deep into not just self-help, but we also talk about trauma. We also talk about, life improvement. And, Christine Whelan is not just the happiness professor, but also the purpose professor. So she talks about that stuff. So if you're into this stuff, if you're into personal empowerment, if you're into self-help and both of the upshot and the potential downside. On all of our socials, we will be live streaming every night that week in support of our annual fundraisers. So come check us out, find us. We love to meet
and
you
we'll
guys.
be playing along at Illuminate. We'll be playing along. I already have the socials all ready to go. Going out every night, telling folks where to go to participate and tune in. It's awesome.
Thank you.
All right. So Dr. Glenn, thank you so much. This has been great. And we're just excited to be along for the ride here. And to those of you watching and listening, thanks for being with us. And this is Confronting the Line. We'll see you next time.